Good evening, everybody. I know the time is not right. This is the end of the session, end of the day. But the topic is so interesting on the importance of emergency medical services in remote sites, especially the industrial sites where we don't have high-end treatment, high-end medical care available, and how to evacuate the patients and bring them to safety, to treat them safely, to save lives as such. My name is Major Tom. I'm the Chief Executive Officer for Response Plus Holding. We are an Abu Dhabi-based company, but we are now in 7 countries, including India, along with my sister company, which is Burjeel Holding. We are the largest healthcare provider in the GCC, having more than 30 hospitals, all JCI accredited. I have a very brief presentation about what we do. In Response Plus Holdings, we are the largest, again, emergency medical service provider for UAE in the private sector, where we are able to ensure that we provide our services not only for the cities but also for remote areas. As we say that there is no higher honor than to be given the responsibility to take care of another human being. We are all here to save lives. And what better way to save lives in locations where immediate healthcare or high standard of healthcare is not available. A little bit of video about Response Plus.
When moments can make a difference, we're able to rapidly deploy, utilizing state-of-the-art resources.
Open your eyes, it's not too late.
Our professional paramedics and EMTs deliver precision care.
Wake from your sleep, it's a bright new morning. Back home you'll be like a newborn baby.
Committed to quality when seconds count. Response Plus Medical Service, here to save lives.
So, industrial accidents is one of the major causes nowadays where we lose a lot of lives. There's this statistic that is there in front of you which says that around 6,500, sorry, the slide is fully not open, 6,500 people died in industrial accidents in India alone in the last couple of years' time, which is very, very alarming as such. The importance of the purpose of health and safety model, I'm sure this has been covered adequately during the course of the day. I will stick to what we are here to discuss, which is the emergency medical services. Some statistics about ourselves, about the total number of patients that we are handling in the remote site clinics as such. As I mentioned to you a little while back, that We operate more than 250 sites in UAE alone. These are all remote sites. We are specialized in oil and gas, where accidents can happen, and the locations are quite remote as such in the industrial setting. So we have more than 350 ambulances and 4 helicopters that we use for providing the emergency medical service to these locations as such. The total number of emergency response drills and exercises that we have conducted in the last 2 years, I feel personally that this is the key for any good response for an emergency medical service to evacuate patients and to stabilize them and to ensure that they are in the right hands as such. We have conducted 399 drills in just 2 years' time, which means that every second day we are doing real-time drills to ensure that we are prepared for any kind of eventualities. Even during the peak COVID time, where majority of the locations were all cut off, they were all isolated, we were still able to provide the best of the emergency medical services through our helicopters and through our ambulances as such. I'll just go one slide behind, please, if you don't mind. This was a drill that we had conducted after a very major incident that had happened in one of the ADNOC sites last year, where there was a drone attack on one of the sites over there, and we were the first ones to start and do a complete full-fledged drill where we evacuated around 150 mock patients to various hospitals of the country.
So, the futuristic and innovative approach on safety evacuation, ladies and gentlemen, these are things that is getting developed as we speak. Use of drones and robots for ensuring that the places are safe and reached quickly without human intervention is something that we are working on very closely. We are also working on predictive analytics, virtual reality training, telemedicine, as in the previous session, the importance of tech in ensuring that the healthcare is available at the respective locations. Mandatory emergency training in remote areas is a must. So, for example, all the 250 sites of ours, we have ensured that each of the doctors and the paramedics and the nurses are trained in the ATLS course. It is mandatory requirement, so that they, at any given time, can handle an emergency situation and stabilize the patient till the time the evacuation can be done. sorry. So I will leave you with this last slide as per me, the EMS for the safe evacuation of casualties in industrial accidents, three most important topics or three most important areas which we should focus on is training. Train the staff, train the staff, train the staff. Number two is to create the SOPs, the required SOPs, and we ensure that we conduct the trainings as well as conduct drills. The more drills that we conduct, the more prepared we'll be in handling these kind of cases in remote areas. With that, I will move on, and thank you so much for this opportunity once again. God bless.